Hi, and welcome to TMJ Unlocked, where we look into all the things that are jaw joint related and how those things affect the entire body. And today we're doing something really interesting. We're actually diving into how obstructive sleep apnea affects the kidneys. And you wonder why we talk about obstructive sleep apnea when this is a TMJ show. Actually, obstructive sleep apnea plays a lot of things and roles in what it does to the body, and how it affects the kidneys is just one of them. And so I have with me today Mindy, who is our myofunctional therapist, and she's here with us to discuss how obstructive sleep apnea affects the kidneys.
Yeah, this was an interesting topic to me when we first started learning about this. And so first I wanted to talk to you about what obstructive sleep apnea is. And that's a repeated collapse or blocking of the airway while you're sleeping. And it leads to intermittent hypoxia, which is a lack of oxygen that's going through, which results in fragmented sleep. So you're not getting into those good, deep quality sleeps that help to rejuvenate and improve our overall body functions, organ functions, and things like that that our body needs in order to heal. It increases our sympathetic nervous system response, which is that fight-flight response that we have, releasing the cortisol in our bodies. And cortisol in that fight-flight response can wreak havoc on all parts of and organs, systems of our body. It basically is yanking us out of sleep multiple times, like we have to fight for our sleep, fight for our lives during sleep, kind of it being when that obstructive sleep apnea happens. So it's really not good and affects every organ system across our body. So how does that lead to the kidneys?
Right? How does that affect the kidneys? So interesting is that when we have that hypoxia, basically that lack of oxygen in the body, it causes oxidative stress and inflammation in the kidney tissues. Now, oxidative stress is when the body has that an imbalance between the antioxidants and the toxins in the body, and the body is not able to control that level of we have decreased antioxidants. So we're not affecting those toxins and getting rid of those toxins out of the body. Instead, those are building up, and our filtration system is the kidneys. Our kidneys filter out all of the toxins in the body. It filters out all of the, just all those extra things that the body doesn't need, okay? And it separates the blood out of it all. So when we damage our kidney tissues, it actually causes a surge in the blood pressure from the apnea events, which damage the glomeruli. The glomeruli are those filtration systems. You have to think of the kidneys as our natural filtration. It just cleans and filters and cleans and filters. That's what it does all day long. However, when we have that surge of that hypoxia, it also promotes insulin resistance and worsens your diabetes, which is a top chronic kidney disease risk. So chronic sympathetic overdrive increases systemic vascular resistance and increases renal workload. What does that mean? That means that the sympathetic system, that fight or flight system, goes into overdrive. It increases your system's vascular resistance, and you get an increased blood pressure, we get increased renal load, and our kidneys are working twice as much. And that's why we say, when you have obstructive sleep apnea, people are like, well, I don't really have sleep apnea. I don't have sleep apnea. I get up because I have to go to the bathroom. And, well, here you have it. Your kidneys are working in overdrive because of the lack of oxygen, and that's why you need to go to the bathroom. So if you're finding frequent times you need to go to the bathroom in the night, that's probably because of the chronic obstructive sleep apnea that you're having. Even just some decrease through sleep disorder breathing. And so it's a vicious cycle. It's a vicious cycle because what happens then is that the kidneys cause fluid retention. Well, and when you lay down, you've got fluid retention, you get fluid retention in the neck. What does that do? It just makes everything smaller. And so your opening in your throat becomes smaller because of the fluid retention. That causes more apnea events, which causes the kidney to retain more water, which causes more obstruction in the neck, which causes the kidneys to retain more water, which causes more obstruction. It's a vicious cycle.
That sounds like a vicious cycle.
So what the research says is that studies show that obstructive sleep apnea increases risk of chronic kidney disease. We just went over that in its progression. And we know that oral appliances or CPAP therapy may slow kidney decline in its early stages, and especially in dialysis patients. Obstructive sleep apnea is often underdiagnosed and worsens cardiovascular risk. And in one study, up to 50% of the people who had chronic kidney disease had obstructive sleep apnea, and most of them had no clue.
Right. So what are some of the signs that you can look for, or maybe within yourself or somebody who you love that you're aware of, to see if maybe they have some signs of sleep apnea? And one of those that was mentioned with Dr. Gunnarsson is nighttime urination. So if somebody needs to get up frequently to use the bathroom, there's a good chance that they're not getting into that good quality sleep because of that cycle that's getting messed up because of the sleep apnea issues that are happening, that's leading to that fluid retention that's causing them to need to use the bathroom in the middle of the night. Also, waking up with morning headaches. That high blood pressure that can happen can definitely cause headaches. And if you're not sleeping well at night, daytime fatigue because you haven't gotten that restful sleep at night. And snoring, gasping, unusual sounds while somebody is sleeping. Healthy breathing is silent and it's soft and it's slow. And if somebody is gasping and noisy, then that's disordered breathing. And so those things are something to look for and something to be concerned about. It's not something like, oh, it's just a small snoring. It's just a little bit of noise. Healthy breathing really should be silent. So what can you do about this? You should talk to your doctor if you recognize any of these symptoms and really push for a full airway evaluation. You want to know exactly what's going on in there. And a little bit of sleep apnea or a little bit, a mild case, that's something to be treated. That's not something to just ignore because something mild is always going to get worse.
It's still sleep apnea.
It's still sleep apnea.
Mild or not.
Exactly. And it's still going to be affecting your kidneys and other organ systems in your body. CPAP and oral appliance therapy are really effective in treating sleep apnea, and it's a lot easier to treat when it's mild. But the moderate and severe cases are not untreatable. They're definitely treatable. So you want to be evaluated and get the best options that are out there. Your doctor may even recommend weight loss for some people, but not all people who are overweight have sleep apnea. So just being overweight or a normal body weight isn't an indication of whether or not you're at risk of developing or even having sleep apnea. And myofunctional therapy will help improve the tone of your airway so that you can be better supported when you're sleeping at night. So if you've been diagnosed with sleep apnea, go and see a myofunctional therapist and get some training in how to strengthen those breathing areas. And if you're a dialysis patient, be sure to push for a sleep apnea screening because it's been shown that people who have chronic kidney disease have significantly increased risks of developing or having sleep apnea. So treating sleep apnea, obstructive sleep apnea, isn't just about sleep. It's about protecting your organs, your energy, and your life.
Definitely, hearing what Mindy has to say, one, she is a myofunctional therapist. I mean, she knows what she's talking about when it comes to strengthening those airways and tissues, those things that we can do to help decrease the effects of obstructive sleep apnea. But also, make sure you're getting with your doctor. Sleep apnea is so underdiagnosed in the U.S., and there are so many people who have it and so many things we can be doing to have healthier and live better lives. So that's it for today. And if you have any family members or friends that you feel like could benefit from hearing this, send them a link. Have them listen to this. And just remember to catch us next time, because next time we'll be exploring more things that have to do with your jaw joint and have to do with your body.